Hello everyone, my name is John Sandham. I'm a Chartered Engineer and Chairman of the EBME website and Expo. EBME in the UK stands for Electronic and Biomedical Engineering. Improving Health Technology Management, HTM, saves money and lives. Here are some facts and figures from the World Health Organization sponsored research. 20 to 40% of equipment remains unused or underutilized, mainly due to a lack of standardization. 30 to 50% additional cost for extra spare parts and maintenance workload because of purchasing of sophisticated equipment with higher maintenance and user training costs, where simpler models would have been just as clinically effective. 10 to 30% of unplanned costs due to poorly specified technology and not challenging the buyers, usually the clinical users. 20 to 35% of equipment out of service due to an absence of or delays in carrying out preventative maintenance. Poor healthcare technology management can result in the loss of 30 to 80% of the potential lifetime of a piece of equipment. My international experience from working all over the world has made me realize that healthcare technology is often disorganized, with inadequate investment and without a systematic approach. Healthcare organizations extend the life of devices, buy new equipment only when it becomes a necessity, and use mixed funding models. By that I mean multiple acquisition routes, multiple maintenance approaches, and leave it up to clinical users to ensure that they get trained. This is a disconnected approach and not strategic. It reduces the efficiency of the healthcare organization, but an improved approach would see healthcare organizations establishing a best practice collaborative arrangement with their suppliers to act as a framework through which all future healthcare technology requirements, such as hardware, software, consumables, can be channeled and then purchased, providing a standardized, fit-for-purpose technology with user training and maintenance to a recognized best practice standard. It is vital to have a robust, up-to-date database of assets with a funded, multi-year equipment investment plan. With the plan in place, suppliers are more likely to offer their best prices on devices procured and subcontracted maintenance. A robust strategy means having optimized device utilization and ultimately lower replacement volumes that will deliver lower costs. I believe in sharing and implementing international best practice models. Only then can we achieve the higher standards of regulatory compliance, performance monitoring, and reporting. Ultimately, sharing knowledge will lead to risk reduction and higher levels of efficiency. All strategic innovations do require investment, and all investment requires approval. Make sure there is a strategic technology plan that underpins the organization's master plan. Technology is at the very core of international plans to deliver transformation and virtual warding, but making these big breakthroughs requires investment in medical equipment and IT infrastructure. To deploy new technology at scale, organizations must have the right foundations in place, which include clinical engineering expertise. If the building blocks that make transformation possible are to be delivered, the technology strategy must include plans for both on and off-site activities. For this to work efficiently, it also requires IT connectivity between different technologies. This is a challenging strategy and will need to address the relationships between procurement, finance, clinical use, and IT connectivity. The procurement is make or break for the healthcare technology strategy. The buying process must be linked to a clear plan and approval process. The financial mechanisms must be ring-fenced and strictly managed. For example, all technology bought, whether from local revenue budgets, capital funds, leased, or some other mechanism, such as charitable funds, must still go through the same approval process. Only then can the strategic impact be achieved, delivering innovations, improved clinical decision-making, better patient outcomes, and organizational efficiencies. Through the smarter use of emerging technologies, healthcare providers can move services from generalized to personalized care delivery. As part of this, it is important to develop clearly understood strategies for buying products that can deliver the plan. All technology plans must be underpinned by standards to ensure that the technology systems can talk to each other. New technologies can also help us to offer more dignified and independent care to people in their own homes, keeping them out of hospital if they don't need to be there. With an increasingly aging population, where, in the United Kingdom, nearly 1 in 7 people is projected to be aged over 75 by the year 2040, and more comorbidities, technology can do so much to help people live independent lives and minimize their time spent in clinical settings. Remote monitoring played a crucial role in the United Kingdom during the pandemic. It showed what could be achieved with the right plan, the right level of investment, and the right technological support. 18,000 people were monitored in their own homes during the COVID pandemic. Rather than being limited by the hospital ward capacity because of bed shortages and with the added risk of infection, one organisation, Norfolk and Norwich NHS Foundation Trust, set up their virtual wards and managed to free up over 6,000 bed days for inpatients. With this initiative, the patient satisfaction levels were 99%. The future? In the 1980s, asset management involved recording of individual items within the healthcare organisation and making sure it was serviceable, with the main function being repair and maintenance. In the last 20 years, medical devices have become not only things you can touch, but also software components, such as Health Level 7 or HL7, which refers to a set of international standards for transfer of clinical and administrative data between software applications used by various healthcare providers. Hospitals and other healthcare provider organizations typically have many different types of computer system used for everything from billing records to patient tracking. All of these systems should communicate with each other or interface when they receive new information or when they wish to retrieve information, but at present not all of them do. HL7 defines a series of electronic messages to support administrative, logistical, financial, as well as clinical processes. We here in the United Kingdom are planning to intensify the pace of the rollout of virtual wards so we can deliver these services across the whole country. The United Kingdom government has made £450 million available over the next 2 years to support this initiative. In the next 20 years, data in the electronic patient records will connect to software systems that use complex algorithms, or in other words, artificial intelligence, to emulate human cognition in their analysis, interpretation, and comprehension of complicated medical and healthcare data. Specifically, AI is the ability of computer algorithms to approximate conclusions without direct human input. The AI conclusions will be immediately available for clinicians to review and enhance their own decision making about the clinical care provided to their patients. A typical system will have data being pushed directly from the healthcare technology into the gateway management software, where it is processed for transmission to the electronic patient record. This is an instantaneous process with 100% accurate data entry. The data can then be used confidently for clinical decision support, clinical research, and finally into AI-supported intelligent systems. Shown on this slide is a typical system deployment that allows healthcare technology to connect to the electronic patient record through the HL7 compliant gateway management system, where the data can instantly be accessed by clinicians and nurses to make faster, better decisions. The data can also be used for clinical research applications and ultimately allow healthcare organizations to develop more intelligent systems. The past, the present, and the near future. Up to around 2010, lots of individual items were being managed and there wasn't really a system of connection between the equipment. Asset management mainly involved maintenance. Coming up to 2020, Health Level 7 software and the equipment that was compliant with that software started delivering clinical data and started being connected into the electronic patient record for real-time clinical information. Now, moving on towards 2040, electronic patient records can be connected to artificially intelligent systems. Connected systems that can deliver intelligent clinical decision support and thereby improve clinical care for everyone. In the future, I expect all healthcare organizations will have a professional healthcare technology management service that looks at how technology can be used to deliver the best clinical outcomes in the most efficient way. The chart shown on this slide represents my preferred setup. Thank you for your time. I hope you found my presentation informative, and if you want more information, you can look at the links below. Thanks a lot. Bye.